Nearly 1 in 7 households in the United States is affected with a neurological disease. Yet many of these conditions, which can cause loss of memory, mobility, cognition, or a combination, have no cure. Some can even be difficult to diagnose or predict. Hi, I'm Megan Cochran, and I'm a genetic counselor at HudsonAlpha Institute for Biotechnology. Over the last several years, genetic testing for neurological diseases has become more common and more affordable. Genetic testing examines a person's DNA to try to identify variants or differences in DNA, which can predict a person's risk for disease or help diagnose a condition. Sometimes the results of DNA tests can help refine a diagnosis, as well as predict a person's risk for developing diseases in the future. New information is still being discovered about the genetic causes of neurodegenerative disease. Some, like Huntington's disease, have a single specific genetic cause. Others, like Alzheimer's disease, Parkinson's disease, ALS, or other more rare conditions like frontotemporal dementia, corticobasal syndrome, or Lewy body dementia, are more complicated. In most cases, a neurodegenerative disease appears for the first time in a single person in a family. This is called sporadic inheritance. In other cases, we may see several members of a family affected, which is likely due to one or more small genetic risk factors. In a very small percentage of cases, there is one single large genetic risk factor which significantly increases the risk for disease in a family. In some cases, genetic testing can help provide information about an individual's specific diagnosis as well as the risk to other family members to develop a disease. However, deciding whether genetic testing may be beneficial can be difficult. Genetic counselors can help make this decision as well as facilitate testing and interpret and help individuals understand results. If you or a loved one has been diagnosed with a neurological disease and think you may benefit from genetic testing, it may be helpful to speak with your doctor who can help coordinate a referral to a genetic counselor. That's a complicated question, but the best answer is that anyone who has a parent or close family member with dementia is probably at some increased risk. However, that may be just a small risk. The risk likely increases the more people in a family who have been diagnosed with the same disease, or if someone was diagnosed at a much earlier age than typical. At this time, genetic testing is most helpful in cases where there's a strong suspicion of a single, very high-impact, strong genetic factor in a family. Factors that may lead us to suspect this would be multiple individuals with the same diagnosis within the family, much earlier age of diagnosis than typical, even in the 40s and 50s in some cases, or an unusual or faster progression of disease. For most people at this time, where there may be multiple small genetic risk factors going on, genetic testing is not especially helpful. However, scientists are working on learning more about these small risk factors, and it's hoped that in the future they will be able to use scores to help determine a person's risk of developing a disease in the future.